Hi, this is Jessica DeMassa, and I'm reporting from HIC 2017. We're in the HISA Studio here, and I'm with Liz. Liz, please introduce yourself for everybody watching.
Hi, my name's Lis Herbert. I'm a registered nurse and the chair of Nursing Informatics Australia, which is a special interest group of HISA.
Okay, fantastic. So tell me about the nurses and the role that they're playing right now in terms of health informatics, digital health. I mean, they're the front line. So what are they up to?
Yes, nurses have actually been involved in clinical informatics and digital health since it was invented. I remember when the first PAS system came out in Queensland, it was nurses who were actually representing all of the modules, etc., and we were the ones who did the implementations, etc. And it's a well-known fact. It's not, I don't think anyone's actually formally studied it, but it's a well-known fact that projects that have nurses driving it actually are successful.
Why do you think that is?
Because nurses are well respected. We're a huge number, like our number is over 300,000. We are the most populous of health people in an organisation, and we're well respected. We know how an organisation works. We know, that we need to get the physio for this, or the social worker for that, or the doctor for whatever, and we basically, run the hospitals. So, one exciting thing I'll talk about is the Nursing Informatics position statement that was released yesterday morning.
Okay, so tell me about that.
Well, that was a joint position statement written with the Australian College of Nursing and HISA and Nursing Informatics Australia as, the lead of that. So that's the first time we've actually formalised that in Australia. So it's very exciting.
So what was the position for? What did you declare?
We've actually said there's 7 key directives for nursing informaticians, or clinical nurse information officers, or whatever that sort of position is within an organisation. So it talks about the necessity for education, to have nurses on all of the projects and system implementations, and it's quite broad,
Sure.
But it's a really good starting point for organisations to actually take and look at it and go, oh, this is what we need to do. So that's very exciting.
That's fantastic. So are you, in terms of like the major health institutions that are here, the hospitals, and even smaller care delivery practices, what can they do to better integrate nurses into their processes so that there is that interoperability that people hope for, so that there is better patient safety and that the data is being collected in the right way and it's being used?
I think they're already there, because as I said, nurses have been actually driving a lot of this for an awfully long time. And I think back to some of the projects that I wasn't directly involved in, but many, many, many years ago in hospitals across Queensland and New South Wales. And those projects were actually started because of a nurse saw a need to either collect some data or make things better, or for whatever reason. So nurses, I think the organisation needs to perhaps put more value on nursing informaticians and the fact that nurses can do these things. You don't have to be a doctor to be a clinical informatics person.
That makes,
So,
yes.
yeah.
And so with the positioning statement, some of the outcomes that you're hoping that will lead to, tell me a little bit about that. What are you hoping that the positioning statement and coming out with a formal stance on how nursing informatics can be improved, what are you hoping to achieve with that?
What we're basically hoping to achieve is that organisations will use those 7 key points and actually employ nurses in senior clinical informatics positions. That's the whole idea, so that nurses do have a voice,
Sure.
and nurses will make or break, and nurses run the hospital 24/7.
Yeah.
So if we don't like it, or had not been involved in it, or included in the decision making, or anything else like that, it possibly won't actually work.
It's very important to integrate the frontline support, without a doubt.
That's right.
That's fantastic. Well, thank you so much, Liz, for joining us. It was wonderful to speak with you here at HIC 2017. Thanks so much for joining us in the HISA studio.